I hope my screen is visible to all of you.
Yes, Bharti, it is.
Yes,
visible.
And the sound is also clear?
Yes,
You can hear?
yes.
The
Okay,
sound
so
is
as
clear.
yeah, thank you very much. So as you all know, this is an NCLEX masterclass. So hello everyone, a very good evening to all those who are present here. In a world where knowledge is at our fingertips and traditional classroom boundaries are fading, it is imperative for educators to adapt, enhance, and redefine their teaching methods. This masterclass has been designed to equip you all with a newly designed NCLEX course. I am Bharti Sharma, Program Manager with Academically. So let me brief you a bit about Academically. Academically is a one-stop solution for global healthcare professionals seeking a broad migration and career advancement opportunities. Based in Sydney, Australia, the team Academically engages with global healthcare educators, healthcare industry experts, universities, and higher education. Yeah.
Bharti, your screen has been paused. Your screen has been paused. Can you please resume your
Is it fine?
sharing your screen? Yes. Please reshare your screen. It has been
Okay.
paused.
Okay.
And Tauseef, it is live or not? तो इसको रिकॉर्ड कहीं कर रहे हैं नहीं कर रहे हैं हम लोग? Okay.
I just reshare my screen.
Excuse me, sir.
Yes, Shafi.
सर ये रिकॉर्ड हमें मिल सकता है फिर यूट्यूब के जरिए?
बाद में मिल जाएगा। यस,
अच्छा,
बाद में मिलेगा।
थैंक यू।
नहीं भारती, एक बार क्या करो, आप इसको बिल्कुल बाहर चले जाओ। आई मीन स्क्रीन शेयरिंग को बंद करके दोबारा से रीशेयर करके देखो।
Yes, sir. Just give me a second.
Yeah.
जी
Hello, sir.
Yes, just wait. We're going to start. Bharti, कोई issue है क्या? तो I mean, you can give in to me or Arindam and can start.
No, sir. Just give me a second.
Okay.
Is it can you see it?
Not yet.
No.
Cannot see.
No.
Sir, I think the time is too short, sir. Most of the staff
Yeah,
have
is it
joined.
clear now?
Yeah,
The class
clear.
is not properly.
Okay, thank you.
Fine, ma'am.
Let me start. Kindly be patient. So,
Yes,
as I
sure,
told you, I was just briefing you about Academically, and I'm sure that you all are very much aware about Academically. We are based in Sydney, Australia. The team Academically engages with global healthcare educators, healthcare industry experts, university and higher education institutions to provide demanding healthcare courses for global audiences. And as you can see on your screen, Dr. Akram Ahmed, he is a clinical pharmacist, and this Academically is the brainchild of him. And Dr. Akram has over 10 years of experience in research, and he has worked in Malaysia, India, Australia, and to name a few, in various subjects of medicines. His goal is to help qualified healthcare professionals across the globe, pharmacists, medical doctors, dentists, nurses, lab technicians, and physiotherapists achieve their passions and dreams by educating and training them. So now I would like to hear from Dr. Akram. So over to sir.
Thank you so much, Bharti. So hi everyone. So today's fourth session is for the nursing professionals who are looking to migrate to Australia. So I can say the nursing professionals in Australia, they need a lot of nurses in Australia. Australia, one of the, top destination for nursing professionals to migrate in last 5 years. And this is, if I compare the top three or top five occupations in Australia, so nursing is the number one. So they need around 2 lakh nursing professionals in Australia currently. So you must think to migrate to Australia. And academically, we have around 90+ percentage the success rate. Courses, and the students are from with us around 55 countries. They are joining us from different, and the faculties are basically the qualified faculties. Those are they pass this exam. They are teaching last several years for NCLEX and others. Yeah. So for the nursing professionals, there is some steps you need to complete in order to migrate to Australia. Number one step basically we call this called document verification. We will help you to complete this. Zia Rahman, I mean, you can talk to me one-on-one after this session. Okay, you have a time to interact with me or faculty. You can ask as many questions you have. So now, please don't ask any question in between. So for Australia, if you want to migrate, there is some steps you need to complete. So number one step called document verification with the APRA. So we will help you to complete this process. No need to worry. You just need to provide us your documents, scan copy, and all those. We will help you to complete. Okay. These are number one step. Number two step, you need to write this NCLEX exam. Okay. So this is the exam you have to pass. This is a very not very tough exam. I can say the mediocre exam or the really easy exams. You can crack this in your first time. So we are here to help you to pass this exam. We will provide you the coaching for 3 months, live classes plus study material, plus a lot of mock tests. So very easy to crack for you this NCLEX exam. And these exams you can complete basically from your home country. So there is so many exams entered in different countries. So you can write this exam and pass this exam. You can migrate to Australia. So number three step basically the English test you have to pass. We will also provide you the coaching for English. In English, you can give basically like a OET exam or PTE or IELTS. Any of these three tests are eligible for Australia. So anyone you can take, and we provide the coaching basically all these three exams. But in general, the student always asks which one is the easier to crack the exam and easier to get the high score. So you can go basically for OET or PT. These are the easiest exam for nursing professionals. So easily you can crack this, And once you pass these exams, so the other three steps, document verification, NCLEX, and English, you can complete in your home country. And there is a fourth step called OSCE exam, the final practical exam. You need to be in Australia. And once you pass this exam, we will help you guaranteed job for you as a nursing professional in the aged care. But if you want to work in any other sector, you can. You are basically free to work in Australia in any sector. So a lot of opportunities for you in Australia as a nursing professionals, and I'm here to help you to complete A to Z process so easily you can migrate to Australia. And I will to interact with you one-on-one if you have any questions at this webinar. I'm here basically. So now we will hand over to our faculty basically, so she will give you the brief, what is about the NCLEX, what is the pattern for this exam, how many questions, what the timing for you, how you are going to approach these questions, So our Kavita Garg is here. She's our faculty. So she's going to take.
Hello, sir. Hello, everyone.
Hi, Kavita.
I think Bharti ma'am is presenting,
Yes,
so
yes,
just give me a second.
Yeah, so Kavita ma'am is here, so she's our faculty. So she will now onwards she will take, कि exam में क्या होता है, कैसा होता है, everything she will let you know, and she will also take one lecture on this topic. Okay, ma'am, over to you. Thank you.
Okay, thank you, sir.
Thank you.
Hi, everyone. I'm just waiting. I can't see the screen here.
Are you not able to see the screen?
So actually, I've logged in from two devices and I'll be presenting through my laptop. So for the laptop, I'm waiting. On phone, I can see the screen. So
Okay.
okay, by that time, I'll just introduce myself. Yeah. Okay, I can try that. भारती मैम आप रुक जाइए. हाँ जी, मैं करता हूँ. You are sharing? I can share. Okay. Okay. Just give me a second. I think here the connection is slow. So, ma'am or anyone else, you only share the screen. I'll just continue from here.
Will you? Yeah, I'll just share.
Yeah. Please share your screen, ma'am.
Yeah, I'm there. Just give me a second.
Okay, so by that time, I can just introduce myself. Hello, everyone. I'm Kavita Garg. I'm the NCLEX trainer or NCLEX coach with Academically, and currently I'm giving I'm running this training program for the students, all the nursing students globally, who have joined us to become an RN, and I'm preparing them for the NCLEX examination.
Kavita
Okay.
is a very experienced faculty. She has last 10 years
Yeah.
training given to the NCLEX
Yeah,
professional.
since 10 years I've been teaching, and I have also experience in clinical side. I've worked in different in areas of hospital in a premier institute in India, which is PGI Chandigarh. So we have been running this course according to the means the allocation of all the subject and syllabus. We are planning this. Okay, so we'll wait for the screen sharing and then I'll start.
Yeah.
So can you see it, ma'am?
Yeah, I can see it now. So basically, students, first we will be just introducing briefly about what is NCLEX and what type of questions you'll be getting in NCLEX exam. And then there's a short class related to the how I'm teaching the students. So a small theory topic I've selected. Okay, so NCLEX preparation course is basically designed to help all the globally trained nurses who could be from any part of the world for this NCLEX exam, which is National Council Licensure Examination for nurses, and clearing this exam helps the nurses become a registered practitioner and get work or PR visa in different countries like UK, USA, Canada, Australia. Okay, so as sir has already told, there's a lot of demand for nurses nowadays. So this is a gateway through which you can look for new opportunities in Australia and other countries also. Next, ma'am. Okay, so the Pearson VUE NCLEX exam is your gateway to prove your excellence, and you can start working after this exam. And the process, briefly, sir has explained that after this exam, there will be a practical exam also for which you have to be in Australia. And after that, the company will help you get a suitable job according to your requirement. Okay, so the main thing about NCLEX exam is it is not like other, online exams which are happening. It is kind of a computerized adaptive testing exam or CAT exam. So what basically is the criteria is that they don't have a fixed number of questions. The minimum number of questions which you can get is 75, and maximum it can go till 150 questions. So it depends upon how you are attempting the exam. Like if every question which you will be getting in the exam, if you're able to answer that question correctly, then according to the level of that question, next question will be a little more difficulty level. And if you're able to answer that also, so slowly the difficulty level of the questions keeps on increasing in the NCLEX exam. That is the pattern. And if at any point you're answering a question incorrectly, then the next question will be a little easier. And then so on, it will keep on, the questions will keep on coming to your screen. So in minimum 75 questions was given earlier, but now it has been changed according to the new NSGN test plan of NCLEX. Now you are getting minimum 80 questions, and maximum questions earlier were too many questions were there, but now they have set the limit to 150 questions. So if you are able to answer all the questions very nicely, then but after the 80th question, your screen will shut down, and that can be both things. Either you have answered very well or you have answered very badly. So in both cases, it can happen. And after that, any number of questions can be given to any candidate depending upon how you are performing in your exam. So that is the basic pattern. Okay, then the type of questions is different. Like some multiple choice questions are there. In some questions, you have to select only one response. And in some, you have to select more than one response, right? So I'll be just showing you the different types of questions. Yes, ma'am, next.
Ma'am, I've already the next.
Okay, the features of the course. Yes, ma'am?
Yeah, can you see this?
No. No.
Rest of the people, can you see the screen?
Yes, yes.
Yes, features of the course.
I got it, ma'am. I got it.
Exam.
Okay, so I'll be just explaining the features of the course if all of you are able to see that. Okay,
Yes.
so basically our course is a 12 weeks course of intensive sessions. So we have live classes also. 70 plus hours of live classes are there, which you can attend online, in which I will be giving you the theory classes and question practice. Everything is there. We discuss questions live also, and you will be getting a lot of questions, because in NCLEX the main thing is the number of questions which you practice. No, so if you do more and more questions, then your chances of clearing NCLEX is higher. So that you will be doing. And then you have lifetime trainer access, means even after you're over your course, you can always post. I request others, please mute yourself. Okay. So you have lifetime trainer access. So that means that you can always consult the trainer for any other doubts also, because sometimes students are not getting the dates for exam immediately after the training is over. So that is not a problem. You can always put up your doubts, and we have a separate platform for that. Discord platform is there, in which I usually give extra information or questions or any other doubts related to NCLEX exams or whatever I'm teaching. If the students have any extra concerns, we have access to that also through Discord. It is just like WhatsApp, no? So they can access the trainer very easily. That is very smooth. Then a lot of questions, as I already told you. So more than 15,000 questions are already shown to different students. They are practicing on their own, as well as we discuss on live classes also. Then the exam pattern. So exam pattern is basically, I already discussed in the beginning, no, 80 to 150 questions is the limit. Minimum questions could be 80 and the maximum is 150 questions. Okay, and different types of questions are there. So I'll be showing you one by one the type of questions. Yes, ma'am. Okay, so this screen, before the type of questions, I'll just explain. Like there is a NCSBN test plan, means National Council of State Board of Nursing has given this test plan for NCLEX. And according to this, they have just divided the different areas of the nursing subjects into certain specialties, and based on that, it is already fixed that how much amount of questions you will be getting from different areas. Okay, so for example, as you can see on the screen, the management of care, management of care portion is 15 to 21%. Means management of care means like if you are having patient of different conditions, how you are managing the patient, no? So questions related to that will be maximum part of the NCLEX exam. You will be getting 15 to 21% of questions from this area. Then next is safety and infection control. Means in this, the question will be like related to prevention of falls, injuries, prevention of infection to the patient, then how you're following the infection control practices. Many questions can be related to that. So these type of questions are 10 to 16% of all the questions in the exam. Then health promotion and maintenance is also comprising 6 to 12% of the questions. Then psychosocial integrity means the mental health nursing part. From that area, you will be getting 6 to 12% of the questions. Then physiological integrity means in physiological integrity, there are different areas, as you can see on the screen. Basic care and comfort will mainly focus on personal hygiene of the patient, how you are providing comfort to the patient, different positioning, then according different post-op care or preparing the patient, providing counseling services, something like that will be there. That is 6 to 12% of the questions. Then pharmacological and parenteral therapies comprise 13 to 19% of the questions, which is a very high number. So pharma is usually the area which is very vast, and usually students have problem in that. So I usually keep on providing different types of drugs and information related to that. Okay. Then there is a section of reduction of risk potential. These questions are 9 to 15% of the whole question paper will be there. Reduction of risk potential means how you are providing accurate care to the patient, avoiding any kind of harm to the patient. Okay. Then physiological adaptation is mainly the different disease systems, like in medical surgical nursing. Usually most of the diseases which are in med surg, obstetrics, pediatrics, they fall under this category of physiological adaptation, and it comprises 11 to 17% of the questions. Ma'am, next. Okay, so types of questions, as you can see on the left side of screen, please see single answers are there, like 4 options are given, one you have to select. Then multiple answers, or SATA, is select all that apply. So what is that? Like some questions you will be getting 5 or 6 options, and then they will be saying that you have to select all that apply. Means there are multiple responses for such questions. So out of 6 choices, it could be possible that only 1 is correct, or it could be like all 6 or all 5 are correct, right? So this is one type of question. Then image-based questions are, you will be given some image, exhibit of anything. It could be a procedure, some anatomical location, maybe like how, where you are placing the defibrillator pads or ECG leads, where you have to place, something like that will be given, and you have to identify. That is image-based question. Then audio-based question, in which you will be given some audio, like it could be some respiratory sounds or abdominal sounds and something like that. So you have to identify which kind of sound is that, or any other thing can also be there in audios. Then calculation is mainly drug calculation, but other things could also be there, like when you calculate burn surface area in a burn patient, then maybe how you're going to do fluid calculation, things like that. Then fill in the blanks is like just simple literal meaning. So you have to fill in the answer. Then arrange in order questions are like you will be given a procedure and you will be given steps of procedure, but they will not be in sequence, and you have to arrange in sequence. Or it could be a body process or pathophysiology of a disease, and you have to put everything in order. That is arranging in order. For example, like you're given a procedure of installation. Yes. Yes, Hasnan?
It mean match the column. It mean match the column.
Which?
You said the filling the blanks.
No. Fill in the blanks is just one line ending with a blank, and you have to fill the blank. And maybe sometimes option will be given. Out of 4 options, you have to put in 1 option in the blank, or maybe it is usually given in like drug calculation. You have to calculate and fill in that. Okay. Then arranging in order. Okay, I explained. Then case study based questions are a very new type of questions which have been introduced this year only in April. In this, you get a case scenario about a patient, like so-and-so patient has come. Briefly, you will be getting history and main vital signs and all about the patient. And you have to, you will be given questions following that case, the brief description of patient, and you have to answer questions. Now, in this case study based question, sometimes you will be getting a case and just one or two, one question related to that case. That is single response case study. And in other type of case study, there will be a case, and then following that case, there will be 6 questions. I'll show you in examples, okay? So these are briefly the types of questions. I have examples in the next slide, so it will be more clear to you. Then the test taking strategy. This is very important because in NCLEX, the questions are very tricky. the language you have to understand. That is why we are giving so many practice questions, because sometimes you feel that this is the answer, but that is not the actual answer. So you have to be very careful. You have to read the question at least twice, read every option completely and carefully. That is very, very important. Then these are basic strategies which, like, while I'm taking class also, I keep telling students that you have to look for keywords in the answers. Then sometimes they have highlighted something like which is the most appropriate or which is the first action you will be taking. So in such questions, many times all the actions will be appropriate, but first action you have to identify. So in that way, NCLEX questions are a bit tricky, and you have to be very sure before answering. You have to read the question 2-3 times, and even the options also, you have to consider every option, so that there is only one correct option. Okay. And also sometimes we can use the process of elimination to choose correct answers. What does that mean? Like if you are getting similar answers, like for any question, sometimes we feel that more than one answer could be correct. Then we can use elimination to choose correct answer. Means which of these should be the less appropriate for this question. Like that, we will rule out the wrong answers, and then the correct answers we can arrive at. So this is the basically strategies which you have to follow when you are attempting NCLEX questions. Okay, so now we have different examples. Ma'am, first example, which was in yes, this one. So this is an example of a case study where, like, you can see on the left side, a brief description of history and physical examination of patient is given, and on the right hand side, the findings of different neurological system and all is given. So usually after such kind of case, you will be getting 6 questions following this. Okay, next, ma'am. Then in this way, after the case study has been given, this is the second page usually. Like you can read it here. It is written, click to highlight below the 5 findings which require immediate follow-up, right? So like when we are going through the options, some of things, like for example, in this case, I'll just briefly tell you, findings like pain increases with inhalation, or redness and edema of the right lower extremity. So any of the abnormal things, you have to just click, they will get highlighted. So that is the way you attempt. Next, ma'am. So this is one example of matrix multiple response items. So there are multiple responses in this question. After a case study, this will be asked, like based on the symptoms of the patient, which of these symptoms correspond to any one of these diseases. Like in this case, 3 diseases are given, and you have to choose, in case of patient, if this symptom is present, it corresponds to which of these diseases. So many times symptoms are like that, which could be present in MI as well as pneumonia as well as pulmonary embolism. But the maximum number of tick marks in a particular disease, usually that disease is the diagnosis of patient. So you can see that it involves a lot of critical analysis. You have to come to a conclusion very carefully after assessing the case study. Okay, so that is a new concept which is introduced in the new pattern of NCLEX exam. So in these type of questions, you have to answer a maximum number of questions correctly, and you cannot just tick mark any box. If there are in these type of questions, there is also negative marking. In NCLEX, negative marking is not there for all type of questions, only a few. I'll be telling you side by side. So in this type of question, there is negative marking if you tick on the wrong box. Next, ma'am. Ma'am, the previous one.
Single
Yes,
answer?
Yeah. So in this one, this is the most basic form of NCLEX question. Earlier we used to have only this form. So this is also a part. Just 4 options you have, and you have to tick mark one option, and there is no negative marking in this. Even if it is wrong, you will just get a 0, no negative marks. Next, ma'am. So this is the multiple response, or SATA, means select all that apply. As you can see for your example, there are 6 options given, and it is highlighted, select all that apply. So why that is written? That is usually in NCLEX questions, the main keyword is given, like the most appropriate, the first action, what would be, and in this case, select all that apply, so that you are able to carefully examine and select the correct answer. And in this case also, there is negative marking for every wrong tick mark. So you have to be careful. The next is the drop down. Okay, drop down box may you will be having options like this. You can see there are two blanks and there is a drop down box. Out of that you have to select, and then you have to drag the item to the boxes which are given. The next type, okay, ma'am has already done rational scoring. Like in this, two answers will be there, and in this case, there will be no negative marking. So if both are correct, you will be getting 1 mark, and if one is correct, then no marks will be there. Okay. Okay, so now we'll be having the academic session. I hope you have got a brief idea about what the NCLEX exam is like and what are the different types of questions. Okay, so I'll just give you a brief class like thing which I usually do for my students. Okay, so I've selected a very small topic. It is actually not small, but I'll have just summarized it. So maybe many things would be left, but this is just kind of a demo to all of you so that you have an idea how the classes are going about. Okay. Yes, ma'am. So high risk neonate we are going to do. So why it is important to identify high risk neonate children. See, identification of high risk neonates is very important, and it is also a role of the nurse that just immediately after the birth of baby, even though pediatrician is there, but it is also the role of nurse to do careful assessment of the newborn so that any kind of defects which are present at birth, like congenital defects, you must be aware of congenital defects. So they are identified, and any abnormality in the child just at the time of birth, if they are identified early, then that can save the life of the child and we can take early intervention. So that is why it is important. Ma'am, next. So next is, I can see the slides in my screen. I'll just continue. Ma'am can then share the screen, right? Common indications for referral of the baby. So in what all cases we usually refer the baby for, we call a newborn as a high-risk newborn. One is when the birth weight of the baby is less than 1.8 kg or 1800 grams, or if the gestational age is less than
Ma'am,
34 weeks.
I think,
Yes?
ma'am, there is an issue. I think somebody else has shared the screen. Some Muhammad, whoever it is.
Yeah.
I think you should not allow others to share the screen.
Tausif, can you check once?
So should I continue then, or should I wait for the screen?
Just a minute. I think Bharti has to reshare the screen. Bharti, you can resume the play button. To share the screen.
So I'm already in the sharing screen. Is it?
It's paused. Just go over there. Just hover around. It will give you an option to resume sharing. Hover around that button. Resume the sharing button.
Yeah.
Yeah, it's coming up now. Yes.
Just a second.
The PPT is still it's visible now.
Okay, it's now visible.
It's visible now, ma'am. Yeah.
Okay. Okay, so common indications for referral means in what all cases we are going to refer the child as a high-risk neonate, and then maybe if some referral services are required. So these cases are like if the birth weight of the baby is less than 1.8 kg, gestational age less than 34 weeks, then, or if the baby's weight and all is okay, but he has delayed passage of meconium or urine. Okay, so then also it is a high-risk neonate. We have to carefully examine the causes. Then if the baby is not able to suck or swallow, because that is the main thing for survival, if he's not able to take feed, he won't be able to survive longer. Then reduced activity or excessive crying. Okay, so that is also an indication that something is amiss. So we have to examine the baby. Then if there are any marked changes in the skin color, maybe the baby is very pale, blue or yellow, because usually at birth, the babies are pinkish in color. So if there is any abnormal color like pale, blue or yellowish color,
Ma'am, you are on mute.
Ma'am, you are mute.
okay, sorry.
Kavita ma'am,
Okay, sir. Yeah. Now
yeah,
am I audible?
yeah, you're audible.
Okay, so I
Okay,
think
okay.
host had muted. Yeah. So, Bharti ma'am, आपका screen is not visible. I'll
It's
just
okay,
continue.
ma'am.
Ma'am can again share screen. Someone else is presenting. Saira, please stop presenting. Bharti ma'am, you have to resume. Okay, I'll just continue then because then it will take a lot of time. So if the baby is having rapid breathing, more than 60 respirations per minute, then also it will be considered a high risk baby. Then if the baby is having bleeding from any site in the body, then it is a high risk baby. If there are any abnormal movements or very poor muscle tone or convulsions are there, again high risk. Then delayed capillary refill time, if it is more than 3 seconds, then we will carefully examine the baby and deal the baby as a high risk baby. Then fontanelles bulging or depressed. In both cases, when the newborn is having either depressed fontanelles or bulging fontanelles, it is a high risk case because there are major underlying conditions which are causing that in the baby. Then any kind of congenital anomalies which are structurally visible or otherwise also if on assessment we find, like as soon as the baby is born, we have to do a very quick examination. And if we find any kind of congenital anomalies, then we are going to refer the baby for high risk management. Ma'am, come to low birth weight babies. Okay. So low birth weight babies is the first condition of means a few I've taken for high risk neonates. So first is low birth weight babies. So a neonate with a birth weight of less than 2.5 kg, irrespective of gestational age, whether he's born full term, preterm, or post term, if weight is less than 2.5 kg, it is considered as a low birth weight baby. So in India, usually 30% neonates are born low birth weight. And if we talk globally, then around 15 to 20% babies are born low birth weight, which is less than 2.5 kg. So approximately, we can see how fatal it can be. 80% of all neonate deaths and 50% of infant deaths are related to low birth weight baby. And why this is happening? Because they are more prone to malnutrition, infections, their body is not properly developed because they have a low birth weight. They are not able to handle the stresses after the birth. So neurodevelopmental conditions can also be affected. So in the next slide, you can see this is some important terminologies based on the chart which you can see here. This is a globally accepted, universally followed growth chart. I hope you are aware of this term, growth chart. So as you can see in the chart, there are two major axes are there. On the horizontal axis, you can see weeks of gestation have been indicated from 24 weeks to 46 weeks. And on the vertical axis, you can see the weight has been indicated in grams from 500 grams to 5,000 means 5 kg. It has been indicated. In some countries, the weight of the newborn is measured in pounds and lbs. So accordingly, we can convert that. 1 kg is usually 2.2 pounds. So accordingly, they would be interpreted. So what this growth chart basically implies, as you can see, there are different markings on the chart. First, just look at the two lines. One is 10th percent and one is 90th percent. So that is a standardized form. If we say that a baby is healthy, he should be falling between the 10th and the 90th percentile of appropriate weight and gestation. And if a baby is below the 10th percentile, he is considered to be like high risk baby. And even if it is above the 90th percentile, then baby is at high risk. So how do we measure that percentile? You can see clearly major things are written here. First, you can see at the horizontal axis, there are markings showing preterm, term, and post-term baby. So preterm baby is a baby who is born before 38 weeks of gestation after 24 weeks. Okay, so before that, we don't consider it because if the baby will not be able to survive. So preterm babies are those babies who are born between 24 to 38 weeks of gestation. Then those babies who are born between 38 to 42 weeks of gestation are known as term babies, and those born beyond that will be post-term. Then on the this vertical axis, please see ELBW, VLBW, and LBW is written, right? So what is that? Low birth weight babies, they have also been divided into 3 categories. ELBW is extremely low birth weight babies, means the babies who are born with a birth weight of less than 1000 gram or 1 kg. Then VLBW are very low birth weight babies who are born at a birth weight of less than 1.5 kg or 1500 grams. And low birth weight babies are those who are born at a weight of less than 2.5 kg or 2500 grams. So in this way, we are going to categorize the extremely low birth, very low birth, and low birth weight babies. Then on the right hand side, you can see terms are written. Short for gestational age or small for gestational age is SGA. AGA is appropriate for gestational age, and LGA is large for gestational age. This is also according to where the baby's growth is falling. If according to the birth weight and term, the baby is falling below the 10th percentile, then it is known as small for gestational age. And if the baby is having, according to gestational age, his birth weight is good, then that will be appropriate to gestational age. But that doesn't mean that he is healthy. Maybe his gestational age is just 34 weeks. So according to that, as you can see on the screen now, just above 34 weeks, you can see around 1.5 kg to, you can say, 2.4 kg. So if a baby is born at 34 weeks of gestation and falling in this weight range, then he is appropriate for gestational age, but that doesn't mean he's healthy, okay? So appropriate or large for gestational age or short for gestational age is just describing a baby's birth weight according to his gestational period. That is not a clear indicator whether he is able to function normally or not, okay? So next slide, ma'am. The next slide I've already described. Okay, so ma'am, then next, prevention of low birth weight babies. Okay. Prevention. So we have seen different categories of high risk, like according to birth weight, then according to gestational age, and according to term. There are different categories of babies. So what we can do to prevent babies from being born as a low birth weight baby? There are many things which can be done. So first is improving social, like these are basically the interventions which usually the different governments imply so that the baby and mothers are fed properly, they have a good nutrition, and babies are born with a normal birth weight. So what all steps we can take is improving socioeconomic and public health conditions, like sometimes of facilities are provided to the mothers, their nutrition is taken care of, proper antenatal examinations, all these things will help mother to have a normal baby. Then upgrading maternal diets, maternal and perinatal health care. This is also something which is usually done by the government agencies. If proper facilities are there, then obviously the result of pregnancy, that is the baby, that would be healthier. Then health education programs, preventing premature births. Then these are all done by the state agencies. Then smoking prevention and cessation. So whenever, as a nurse, if you're working in an antenatal area and the expecting mothers are coming, we should always educate them about the importance of avoiding any kind of smoking or alcohol, because that has a very bad effect on the baby's growth. Then expanded access to preconception counseling and care. That is the same thing which I discussed. No, counseling and care is very, very important, because based on that, the mother will be able to give birth to a healthy baby. So preterm infants. Next is the preterm infants, another high risk case. So approximately 1 in 10 babies are born preterm. Preterm means before 37 weeks of gestation. That is the worldwide data. And what happens in preterm? We all know that if a baby is born before term, then obviously his body has not formed adequately to adjust to the external environment. Inside the womb, the baby is totally dependent on the mother. But when he comes out, his body should be ready to face the external environment. So in case of preterm babies, they will have anatomical as well as functional immaturity. So it will make them very vulnerable, and high mortality rate could be there. Then categories of preterm infants. This we have already discussed, no? Extremely preterm, very preterm, and moderate to late preterm. So when the baby is born between 32 to 37 weeks, it is called late preterm or moderate preterm. Then if it is born at a term of 28 to 32 weeks, then it will be called as very preterm. And those babies who are born before 28 weeks of gestation, they are called extremely preterm, and their survival rate is very less. Okay? So what could be the causes of preterm births? There are many causes. So these all conditions we usually discuss in our whole week of, we have 1 week divided for pediatrics and obstetrics, etc. Like that, we are covering the syllabus in our NCLEX batch. So I'll just mention briefly because details cannot be done in one class. So spontaneous causes of preterm births could be APH or antepartum hemorrhage. I hope you're aware of the terms like placenta previa, abruptio placenta, any of these abnormalities. If it happens in the mother, it can lead to preterm deliveries. Then maternal malnutrition is also a factor which can lead to preterm births. Cigarette smoking, drug addiction, acute physical or emotional stress, sexual activity, traumatic stress. Then multiple pregnancies, usually when the mother is expecting and she's having twin or triplets, then there are high chances of preterm births. Then if the mother is very young, she is not, reproductive system is not very well developed, then also it could be there. Zahur, are you asking something? Mavish, please mute yourself. Okay, ma'am, next slide. So we have seen the spontaneous causes which can occur on their own due to multiple reasons. Then we have induced causes. Sometimes we have to conduct preterm birth deliveries and the baby is born preterm when the mother is having certain disease conditions in which there is a risk to the mother or to the baby or to both of them. Okay, so they are known as induced causes of preterm deliveries or preterm birth. They are like maternal diabetes, heart disease of the mother, unsatisfactory fetal growth. If we are constantly monitoring the baby and he is not growing adequately according to his gestational age, then also we need to sometimes induce labor and deliver the baby. Then eclampsia, preeclampsia, hypertension, these are specific disease conditions which will be discussed in other classes. Hypoxia, fetal distress. If at any time during the pregnancy we feel that the baby is having hypoxia, distress, or sometimes bradycardia is there, then we have to immediately induce labor and we have to deliver the baby. Otherwise, the baby will not be able to survive. Then APH, we have seen that in cases of APH, it was spontaneous also. Sometimes because of APH, the delivery occurs on its own and sometimes we have to intervene, then it becomes an induced cause. Then severe RH immunization, like if the mother is RH negative and the baby is RH positive, then there is a huge risk to the life of baby. And if proper monitoring, and there is a drug also which is given to prevent any abnormalities in these cases. If it is not given, then also we have to deliver the baby prematurely. So these all causes can lead to the birth of baby preterm. So next, ma'am. Okay, it's already there, ma'am. Back. So characteristics. I think this is a mix-up. I'll just tell you verbally. Ma'am, you can move to next slide. Characteristics of preterm infants. This is a slide is I think misplaced. So what all characteristics we see in a preterm infant? Usually they are very thin and lean. Appearance will be very poor. Poorly built, skin mass will be there, and fat tissue is very scarcely developed. Very scanty hair development will be there. As you can see in this picture, preterm baby has a very scanty hair, and also the ear cartilage though it is not very clear, but ear cartilage is very soft. It is not developed properly. And if you put a little bit of pressure on it, it will not be able to recoil. So that is a clear indicator that the baby is not developed properly. Then if we see the preterm babies, usually their head is very large as compared to the whole body. So and then their sole, the sole of the foot, it has very few creases. So these are certain indications which we will be knowing that it is preterm because it is born before term, but otherwise physical appearance also gives an indication that it is a preterm baby. Okay. Then apart from the physical appearances, the physiological handicaps can also be seen in a preterm baby. Like if the baby is preterm, he will be having rapid, shallow, irregular respiration. There may be periods of apnea or cyanosis. Then sucking and swallowing reflexes are very poor, and that makes even more challenging because they will not be taking feeds adequately, and it will further affect their health. Then peripheral circulation is inadequate. So maybe capillary refill time will be poor, or maybe they will be having some amount of peripheral cyanosis can also be there. Then they are more prone to develop hypothermia because the fat tissue, subcutaneous tissue is not that well developed. So cushioning is not there. So they are more prone to have hypothermia. Then also cardioesophageal sphincter is not completely developed. So they can have a high risk of aspiration, regurgitation, etc. Then these children are also 3 to 10 times more vulnerable to infection, and we have to educate the mother and the family that they have to be very cautious, take extra precautions to prevent the baby from infections, and urination may also be delayed. So all these physiological things could be there in a preterm baby, which makes it even more difficult for the baby to survive. Next, ma'am. Then management of preterm babies. First of all, we have to manage the high-risk antenatal mothers. If we are doing that normally, many preterm births can be prevented. So they will not happen. So it will be good. Then if they are coming for delivery, means the mothers who are at high risk, then delivery, if we already know that it is a high-risk case, it should be always attended by a neonatologist for prompt management. Like if we are having mother who is having gestational diabetes or hypertension, or multiple pregnancy is there, or there is a previous history of abortion, these all are maternal risk factors. So if the mother is already having any of these history or current disease, then a neonatologist should always be present at the birth time. Okay. Then at birth, what all things will be required? We should have all resuscitation measures ready for the baby. It may be required in some cases. Then as they are more prone to hypothermia, so adequate arrangements should always be there to prevent hypothermia, like proper room temperature should be there, warm temperature should be there, the warmer should all be ready for the child, and incubator also should be kept ready if it is needed, and baby should be immediately covered after cleaning. Then delayed cord clamping is a recent concept which has been started since a few years. It is very helpful in preterm babies. So normally immediately after birth of baby we clamp the cord, no? But in case of preterm, if we just delay the cord clamping by around 30 to 60 seconds, it leads to a lot of benefits. Means more amount of RBCs can be passed on to the baby, and it will be helpful for the baby to get more immunoglobulins from the mother. Then another important thing is, after we have stabilized a preterm baby, just immediately after birth, we should transfer the baby to the neonatal ICU. Then next, breathing has to be taken care of. Air passage should be clean. This is done for normal babies also. So this is the similar. But in this case, we have to do tactile stimulation by sole flicking and to stimulate respiratory effort if it is poor. Then we should, after preventing hypothermia, constantly we have to maintain a stable body temperature in the baby. Around 36.5 to 37.5 degrees centigrade should be maintained. Kangaroo mother care is very helpful therapy which is given for preterm babies. Usually it was started for preterms only, but now it is given for other categories of babies also, like low birth weight, or even term babies can also use it if they are slow in response. So this is another topic to be discussed in detail. Then bathing should be delayed. This is very important because parents may have doubts related to care of baby at home. No, so as a nurse, you have to educate that in case of preterm babies, at least by 10 days, bathing should be delayed. Okay, because they do not have their mechanism of managing body temperature. No, hypothermia chances are there. Then nutrition and hydration is very important. Early initiation of feeding, and usually preterms will have a very poor sucking reflex. So maybe sometimes fluids will be given, or with the help of spoon, we can start feeding the baby. And even if the baby is having poor sucking reflex, the mother should be encouraged to express breast milk and start feeding of the baby. And nutritional supplements have to be given, like especially vitamin D3 and iron supplements are given later on, not immediately after birth, but in later on stages. They are usually given in drops to the newborns. Okay, so this is two categories we have seen: low birth weight, then preterm. Then another is IUGR, intrauterine growth retardation, or small for date babies, means while inside the womb their growth is retarded. Okay, this can happen in different forms. It could be symmetrical, asymmetrical, or mixed kind of IUGR baby. Okay, so we will see one by one what they are. Asymmetric IUGR babies are those like who were earlier, in the earlier part of pregnancy, they were growing normally, but during the later part of gestation, suddenly their growth started getting slower. That is asymmetric IUGR, also known as malnourished SFT, short for date. So their appearance will be thin, long, merasmic, but they will be alert. Subcutaneous fat is very less. Excess skin folds will be there on the buttocks and thighs. Back of hands and feet are sorry, back of hands and feet are wrinkled, and better prognosis will be there if appropriate nutritional rehabilitation is given. So usually they are means they can survive better if there's asymmetric IUGR. Why? Because initially they were growing normally, no? So most of the body parts are formed in the initial part of pregnancy only. So they have already formed, but later part of pregnancy is usually more about the establishment of functioning and more growth in the different body areas. But major organs are formed in the first trimester only. So that is why their survival is better. Then second category is symmetric IUGR or hypoplastic IUGR, SFT. So that is when, since the beginning of pregnancy, the baby is not growing adequately, and that is why, because the major portions of body which are formed, they are maybe also not developed properly. So poor prognosis will be there, and they will be small in all parameters, including the head also will be very small. Okay. Then the third category is the mixed group, and you can have the picture also. Mixed group is usually, they do not have an obvious malnourished or grossly hypoplastic look. They have mixed features. So as you can see in the picture, the symmetric IUGR, then the asymmetric one has a bigger head size and appropriately grown baby also you can see. And then femur sparing IUGR, in this you can see the femur bone has been clearly indicated that growth is adequate, but maybe other features are not properly developed. So main difference which you have to remember is between the two center pictures, symmetric and asymmetric. So in asymmetric, head size is larger. Is somebody asking something? Maroof, are you asking something? Okay, maybe by mistake. Yeah, yes. Okay, then let's see next slide. So ponderal index is also a very good indicator of, when clinically we are not able to distinguish, then with the help of ponderal index, this is one index in which the formula is given on the screen. We calculate this for the newborns just to be sure whether their growth is appropriate or not, right? So the formula is weight in grams into 100 divided by the length of the child in cubic centimeter, right? So with that, we will obtain the ponderal index for the child. And usually the ponderal index in neonates should be around 2.4. Okay, so if it is less than 2, then it is asymmetric IUGR. And if it is more than 2, then it is usually symmetric IUGR. So clinically, we can use this to distinguish between the two categories. Then what are the causes of short for date babies? Short for date means who are not grown properly according to their gestational age. Why this happens? There could be some maternal factors, placental factors, or sometimes fetal factors or environmental factors could be there. Maternal factors are like mother is having a very short stature, or mother is primigravida, or maybe grand multipara means. If you're aware of these terms, primi means she's pregnant for the first time. Grand multipara means she already has delivered many children and it is her maybe third, fourth, or fifth pregnancy. Sometimes it can happen. Then if it is a teenage pregnancy, then also SFT babies can be born. Then if the mother is having any kind of illnesses, which are, sound is not audible. Someone is writing that. Others, am I audible?
Yes.
Okay, so maybe connection is weak. Someone was saying that. Okay, then placental factors, abruptio placenta, if it is present, then it is a condition because of which maybe the baby's nutrition inside the womb will be affected. So he may be born short for date. Then sometimes there are many conditions, medical conditions related to placenta, umbilical cord. They are not normally formed. Then also SFD babies may be born. Then fetal factors. Sometimes when the baby is a first-born baby to the mother, then also it could be a cause. Twin pregnancy, multiple pregnancy, genetic or chromosomal aberrations in the baby can also lead to SFT. And sometimes poor socioeconomic status, cultural practices, which are harmful for the baby's growth or the mother's health. There are many practices, different in different regions of the world. There are practices related to the birth of baby, which are still practiced. They may also harm the baby. Racial and geographical influence is always there. Different races have different build of their babies, so that is an important factor. So what are the problems which will happen in SFD babies? They will be having fetal hypoxia. Sometimes intrapartum death can occur. Intrapartum means while the time of delivery. Then sometimes they can have severe birth asphyxia. Congenital malformations may be present. They may have hypoglycemia or hypocalcemia, inappropriate thermoregulation, hyperbilirubin. Many things can happen. So these will be discussed later in other classes. Then management of SFT babies. What we are going to do if you have the posted and SFT babies born. So it is similar to LBW babies, low birth weight babies. Okay, but prognosis is much better than preterm because they are just short for date. Maybe they are born in proper gestational age, but just the growth is not that much. So physiologically they will be mature. So a little better prognosis is there. If birth weight is more than 1.8 kg, then home care is sufficient for SFT babies. If it is between 1.5 to 1.8 kg, then secondary level neonatal care unit may be required. And if the baby is less than 1.5 kg, that means low birth weight and SFT also, then obviously we have to manage the baby in the neonatal ICU. Okay, so another condition is infants of diabetic mothers. This we will be discussing briefly. The main high-risk babies which I wanted to discuss was low birth weight, short for date babies, and IOGR babies. I hope that much is clear. So another two minor things I've included. One is infants of diabetic mothers. So when the mother is having diabetes, sometimes a diabetic mother is conceiving, or maybe during pregnancy she acquired diabetes for the first time, which is known as gestational diabetes. Okay, so someone is asking how long the session will continue. I think only 5-10 minutes are left. Okay, so in diabetic mothers, the main problem is that the baby will be having two major problems. One is that baby has macrosomia, means he will be very large in size, usually more than 4.5 kg, maybe there. So it can have difficulty during the time of birth, which is known as dystocia or difficult delivery or obstructed labor. And another major problem is that because mother is having diabetes, she's taking insulin also. So when the baby is born, sometimes he has major hypoglycemia. So we have to immediately start feeding of the baby. And if that is not possible, then maybe sometimes dextrose IV has to be given to the baby. So please remember that two major issues with the baby of diabetic mothers are, one is macrosomia, which can cause dystocia or obstructed labor. And another one is that baby will be having hypoglycemia as soon as they are born. So we need to attend to that need. Okay. So as you can see in the picture, the babies of diabetic mothers are very heavy, plump, full-faced, covered with a lot of vernix caseosa, with the cheesy white layer on the skin of the babies. Then this is the most common cause of large for date babies. Usually these are the ones who are LFTs. Maternal hypoglycemia leads to fetal hypoglycemia also, and there is a lot of fat accumulation in the baby's body. So sometimes the major risks are macrosomia, I already told you, hypoglycemia also I mentioned. Then congenital anomalies can also occur because they have a very large size. So sometimes cephalopelvic disproportion can occur, which can put pressure on the babies, cause congenital anomalies. Then sometimes sudden fetal deaths have also been reported in the last trimester of pregnancy. So for that, usually many times we have to manage the baby accordingly. We have to sometimes induce labor at 38 weeks or sometimes at 37 weeks also, if there is a risk to the life of the baby. Okay. Then management, mainly we have to, I told you, start oral feeding as soon as possible. Then if that is not possible, then dextrose will be given. Usually we will be giving a bolus of dextrose. 10% dextrose bolus will be given, and then infusion of 10% dextrose will be given to the baby. Okay, so that is the main management. The next slides, I think, ma'am, you can skip that. There is some mismatch of slides. The introduction part is missing here. So another category I had mentioned there. So I think we can skip that one. Then, ma'am, you can come to the conclusion slide. So see, as you also must be knowing, there are many other conditions also in the high risk cases. No, I have tried to just make a brief class because so many people are here and different time zones are here. So just the main things I have discussed, just to give you an idea how we are conducting our classes. So this is the conclusion slide. I'll just read it out. High risk pregnancies which are associated with birth of high risk neonates should be identified earlier, and sufficient measures should be taken to prevent the life of the baby. Okay, so the main purposes, that is all in the theoretical part of our presentation. So main thing which we wanted to convey is that we are conducting theory classes like this. We have divided the whole topics, or you can say syllabus, which you study in BSc nursing. The whole 4-year syllabus is summarized into a 3-month course. And first we are conducting these theory classes. At the end of every week, we are having mock test. Live mock test discussion is also there. And apart from that, some practice questions are given to students. And in the last month, we are mainly focusing on providing more and more practice questions. So NCLEX is all about questions. The more number of questions you do, the better performance you will be having. Thank you. Any questions? Now you can ask. You're open to question.
Yes, guys, anything you can ask regarding, a process, visa, job, or regarding this class.
Hello, sir. I have a question.
Yes, Meeta.
Yes, actually, I'm from Bangladesh, and my question is, if I do this course from online, after completing this NCLEX course, how I will sit for exam? Because in Bangladesh, as I know, there is no NCLEX exam center.
Yes, you have to basically come to India. So India, we have several exam centers. You can come to India and you can write the exam. And for Bangladesh, no problem for you, the visa, easily you can come to India, right?
Yes, another question, what is the cost of this course and what is the registration fee of NCLEX exam? Because
yes.
I have no idea.
Yes, so I think our team will get back to you. So we have basically the loan facilities. We also have the scholarship and all those things. So Arindam, is there any link or something to fill the form?
Not really.
तो फिर ये कैसे लीड का कनेक्शन होगा?
I think if they leave the details, like contact,
they can leave their contact. Yeah,
they can just leave the details on the chat box, and we can contact them from there.
Please leave your full name and with your phone number, with country code and your email ID. So we will get back to you one on one. So we also have sometimes some offer or some other the information to you. So we always share with all the students. So please leave your
So one more thing we can add. I think most of them have received the link on WhatsApp to join this meeting. So you can directly revert back on the same WhatsApp number as well.
You can share your number, Arindam. I mean, whatever the counselor's number over there.
Sir, kindly share your WhatsApp number. I want.
Yeah, just use the chat box and share the numbers, the counselor's number in the chat box.
Right. I'm doing something with giving a number.
Or maybe we can highlight, this number, or so they can note down, so they can WhatsApp on that number.
Just give me a minute.
Excuse me, sir. I have a question.
Yes, Sarah.
Sir, I just want to know, for the lecturers, can they appear for the PR process?
What lecturer?
Like for the registered nurse, if the nurses want to work in Australia as a registered nurse, is it mandatory for her to get the clinical experience?
No, if someone is a fresh year, they can. But obviously, someone is graduate like 10 years back and their last 10 years, he is not doing anything, This is a little bit difficult to get a job. So if you are working somewhere, definitely you have to show,
Working at the academic level, not at the clinical side.
So basically, are you in which field currently?
I'm in teaching field.
Okay, you are in teaching. Actually, you can basically, if you are in teaching.
So I'll be teaching for the BSc nurses, sir.
Okay, that's good. I mean, still you can. If you have a teaching experience, still you can show.
First, my experience is at the clinical side. So I did my PG.
Sir, I have a question, sir.
Basically, there is no requirement from the exam side. You can see there is no work. Please one by one unmute and then ask.
Asit, can you mute everyone and then they can unmute themselves?
Yes, Hassan, please ask your question.
Sir, I am BSc student and I have an experience in 3 years of our clinical experience. So
what?
Sir?
What is qualification?
Sir, I am now in this year I can complete my BSc in nursing.
जब कंप्लीट कर लो, रजिस्ट्रेशन हो जाए, उसके बाद कॉन्टैक्ट करना, ठीक है?
Excuse me, sir. I would like to say something about this job. Can you tell me?
Yes, sir. This is
Sir.
if anyone want to work in Australia, so there is a 3-step process you have to complete. This is 4 steps. The number 1 step is called document verification, and then you have to write this NCLEX exam. Then you have to pass English test, and then you have to write this OSCE exam. Pass, then you can apply job, and you can migrate to Australia with your family permanently on permanent visa. So this is the process for Australia in general.
Sir, if you don't mind, finish your NCLEX exam, MCQs related question.
Yes, you can ask.
How can I apply for the?
How can I apply?
सर सॉरी सर, मैंने ये कहना था कि ये हम जो NCLEX एग्जाम जो है वो हम MCQs अगर मिल सकते हैं हमें?
MCQ से थोड़ी नहीं पास हो जाओगे, MCQ मिल सकते हैं। ये यूएस का एग्जाम है। यू आर प्लानिंग टू माइग्रेट ऑस्ट्रेलिया, इसकी स्टडी करनी पड़ेगी। MCQ से पास
तो यही कह रहा है ना, तो स्टडी की जो हमारे जो मतलब
तो वही तो
होते हैं उन रिलेटेड,
तो मैडम ने जो आपको पढ़ाया वही ऐसे ही पढ़ाएंगी वो आपको।
जी ऐसा ही है ना।
हाँ,
यस सर।
तो ये कोर्स है पूरा हमारा 3 मंथ का। हम लोग लाइव सेशंस लेंगे, स्टडी मटेरियल देंगे आपको, प्लस मॉक टेस्ट होगा, वो सारे के सारे होगा। वो आपने किया 3 मंथ में, देन यू कैन पास एग्जाम।
सर इनका टोटल कॉस्ट क्या है?
कॉस्ट के लिए जिस नंबर पे आपको, जिस व्हाट्सएप से आपको मैसेज आया होगा, उसी पे आप रिवर्ट
सर
करके अप्लाई कर दो.
ठीक है सर, ठीक है
ठीक है?
सर.
Because most
Thank
of
you.
you are joined from
Sir,
someone give you the link on WhatsApp. So you can reply on that WhatsApp number also, or you can hear the WhatsApp number already be given to here, +91 730 24 11106. तो ये हमारा व्हाट्सएप नंबर है, आप इस पे हमको व्हाट्सएप कर सकते हो. ये हमने चैट बॉक्स में दिया हुआ है, अरिंदम दत्ता ने. ही इज आवर मैनेजर. ठीक है, तो अरिंदम ने जो नंबर दिया है, आप यू कैन बेसिकली व्हाट्सएप ऑन दैट नंबर, और मे बी यू कैन लीव योर फोन नंबर, ईमेल with your name in our chat box. We will contact you one-on-one.
okay. Hello, sir. I'm
Yes,
from Pakistan.
yes.
I would like to know कि NCLEX टेक्स्ट तो ठीक है पास करते, बट इसका CGFNS का क्या इसके साथ रिलेशन है?
ये कौन सा रिलेशन आ गया, मतलब पता नहीं क्या आप बोल रहे हो. ऑस्ट्रेलिया में इन जनरल कहते हैं, यहाँ पर एक एप्रा एक बॉडी है. ठीक है, तो एप्रा में सबका रजिस्ट्रेशन करना पड़ता है. ठीक है, तो उसका क्या रिक्वायरमेंट होता है कि आपको ये 4 स्टेप का प्रोसेस करना होता है. डॉक्यूमेंट वेरिफिकेशन होंगे आपको, फिर आपको एंट्रेंस एग्जाम पास करना होगा, फिर आपको इंग्लिश का एक टेस्ट पास करना होता है, फिर ऑस्की पास करना होता है, फिर आप ऑटोमेटिकली एप्रा में आपका रजिस्ट्रेशन हो जाएगा एज रजिस्टर्ड नर्स. ठीक है, देन यू हैव टू अप्लाई PR वीजा, परमानेंट वीजा with your family. You can come to Australia in general.
Okay.
Excuse me sir.
Yes.
सर डॉक्यूमेंट वेरिफिकेशन के हम लोगों ने एक मरतबा करना है बस लाइफ टाइम?
हाँ, एक बार होती है लाइफ टाइम के लिए.
मतलब लाइफ टाइम एक ही मतलब आपने रजिस्ट्रेशन
अरे भाई, एक ही बार
करना
तो आप एग्जाम भी एक ही बार दोगे, बार बार एग्जाम नहीं देनी पड़ेगी आपको.
है. ओके
एक ही बार एग्जाम.
मैं कैसे अप्लाई कर सकती हूँ?
I am from Bangladesh.
Yes, yes.
Sir, please, sir, can you provide some lecture to us?
I mean, you have to buy this course to get the access for this course. So today we just give you like kind of one demo. So this kind of things we are going to teach you how we are going to help you to complete the process. So please leave your phone number, email in our chat box. So then we can talk to you one-on-one. Yes, Polak, can you please ask your doubt in English?
Excuse me, sir. I'm a registered nurse. I'm from Pakistan. Can you tell me how I can apply as a registered nurse from Pakistan to New Zealand with family?
जो आपको बताया था अभी, मैं 4 बार प्रोसेस बता चुका हूँ. सेम प्रोसेस रहेगा. इसका 4 स्टेप का प्रोसेस होता है. आपको फर्स्ट यू नीड टू रजिस्टर योरसेल्फ विद न्यूजीलैंड और ऑस्ट्रेलिया, देन ओनली यू कैन वर्क. विदाउट रजिस्ट्रेशन you cannot work in any country. You must be registered nurse in that country. So for that you have to pass this exam. This is this like a document verification, the NCLEX exam, the English test, then again OSCE exam, then you will register as a nurse. Then you have to apply the PR visa, permanent visa with your family. So
Thank you, sir. Thank you so much.
Hello, Mr. Abraham.
Yes, please.
Okay, I'm Kavita. I last information to you already. Sorry, I speak English because I cannot hear some conversation related with the national language. Okay, I will ask you about related with the English test. Need to pass IELTS first or cannot pass?
I'm not able to understand what you are asking actually. Can you please write your question in English, or maybe you can ask me in English?
Okay. Okay. I want to know about. I heard that your answer relate with the need to we need to pass the NCLEX exam and IELTS test. We can apply to the work at Australia, right?
NCLEX plus OSCE, both are mandatory to get full registration as a registered nurse in Australia. So first you pass NCLEX, then you also need to pass OSCE exam. It is a practical exam. Australia to write that exam, okay? And then you can register as a registered nurse in Australia. Then you can work here.
Okay, one more question. How about English test?
That's why I've told this is a 4-step process. English is mandatory. First, document verification, then NCLEX, then English, then OSCE. These are the 4-step process. English is mandatory. So you can go for IELTS or OET or PT, any English test.
Okay, thank you.
Australia is an English speaking country, so English is mandatory.
OET or other CET?
Any you can give. We will provide you the coaching for this.
Sir, how many codes for OET or PT?
Yes, 7 individual band in IELTS or 65 in PT or OET-B.
Sir, I have question.
Only
B. It is not only A or B or C grade, right? So B with they need.
Okay. Sir, I got
I have a
Hello. So is it okay?
Yes, Mita.
Hello, can we make a question, please?
Your voice is not clear.
Sir, I have a question. Sir, I got 55 in PTE exam. So is it okay?
Yes, if you have 65 individuals, it is fine, perfectly fine.
Okay, thank you, sir.
Thank you. Yes, next please,
Sir, yes. Sir, these online classes, can we purchase something or free?
Yes. So please leave your phone number and email in our chat box. So we will get back to you.
Yeah.
Okay.
Can I make a question, please? Can I have a question, please?
Yes.
Hello?
Yes,
Yes.
please.
Yes, I'm Santara from Bangladesh, and my question is the nursing curriculum over here are fully different from the Western countries or other developed countries. So it is quite difficult for us to pass the exam, NCLEX exam or OSCE exam, because our standard is not the same. So how we can overcome the barrier, and how we can overcome the obstacles and can develop ourselves up to that level.
Anyone did 4-year bachelor degree in nursing from any country, they are able to pass the exam. This is not very something they are asking. This is that's why we are here. So based on their syllabus, we are going to take classes. So they will ask you the question, what do you already study in your whether it is Bangladesh, Pakistan or India. The syllabus for nursing around the same around the world, you know. So they are not going to ask something that you don't know. You already know basically the thing.
Okay, because the main difference, so far I know, that is we actually focus mainly on the practical. Bangladeshi nurses doesn't deal with the medications or prescriptions much. We are not allowed to do the prescriptions. But what I have heard that the developed countries nurses are allowed to do the prescriptions.
No.
So,
Nurse
yes, please.
Nursing professional cannot do any prescription in Australia. Nurse are not allowed to give any prescription. Only medical doctor allowed to give a prescription in Australia.
Okay,
so
right.
We are going to ask you that question.
Okay, and my another question is, do you have any age bar over here?
Yeah, definitely 100%. Your age must be below 45 years of your age. Below 45 years age.
Up to 45 years.
Yes.
Okay, and what's the IELTS score? Do you need any IELTS score?
7 individual band.
7 individual band is pretty hard to get. Academic? Are we looking for an academic?
Yes.
But then you can go for OET also, no? OET is
You can
said
go
that it is
OET,
easier.
you can go PT, any test you can go.
Yeah.
Okay.
This is not something very tough. It is very easy, I can say. You know, you are migrating to Australia and you are going to delay English patients. So if you are not able to speak, so you know how you can deal with the patient, in the hospital. So English is mandatory to migrate to Australia, whether it is a And this is 7 for everyone. It is a medical doctor, MBBS, MD doctors also they need to get score 7. Pharmacist, nurse, lab technician, physiotherapist. There's English requirements. Same for everyone, all healthcare professionals.
Okay. 7 in each band?
Yes.
7 in each band. At least 7 in each band.
Or you can go the OET. We provide coaching for OET and PT. So these are the easier exam as compared to IELTS.
Okay. So you're saying that you are going to take classes on the NCLEX. So how are we going to get that? Do we have to purchase?
Yes, we have a mobile application. You can access the class in mobile or laptop, desktop, whatever you have. So you have to purchase this course from us. So please provide us your phone number, email in our chat box. So our team will get back to you. Or we are already give you the number in the chat box.
Yeah, I'm interested, but the thing is, I am over 45. I'm over 45.
Then no chance. Then be happy in your home country.
Hello?
Be happy in your home country. If
Hello?
you are over 45, we can't help you. I mean, they are.
Okay, all right. Okay, thank you very much.
You are going to be like somebody, if they hire like 50 year of a nurse, after 10 years, you are going to be retired. So they need a person to work in Australia, not something like, they are hiring. They need nursing professionals. And general, basically in Australia, any professional, the age must below 45 years of age. Okay, whether it is a nurse or engineer or pharmacist or any other profession. For this is the restriction for the visa, not for the job or the registration. You can register, but you will not get the visa.
Okay.
Yes, please. Next, please.
Okay. Thank you very much. Nice talking to you.
Thank you.
Thank you.
I don't know, can we show in any slide or something, then it will be good. Many of them, like they are not able to read in the kitchen. Or maybe I can show our website number, WhatsApp.
Yeah, I am actually, sir, adding it on the chat over here, but I can read it out for everyone. I mean, I will read it out slowly. Guys, please note it down once. You can definitely drop us our WhatsApp text, right? So the country code is +91 followed by 730-241-1106. I'll repeat again. +91 730-241-1106. I hope everyone have noted it down.
Yes, next, please. Yes, किसी का कोई any other question? Khan Salim.
Good evening, sir.
Good evening.
Sir, as I am a nursing graduate from Pakistan having 3-year experience, I would like to ask about your classes duration and fees. And is it online or offline?
This is online classes for 3 months. Okay. So 3 months is more than enough to pass this exam. You basically need to study at least 3 to 4 hours per day for 3 months, for 90 days. You will definitely able to pass the exam your first attempt.
Yes, sir. And the fees part, sir?
You just leave your phone number in our chat box, or we already give you this number. You can just drop in the WhatsApp. So our team will get back to you. Okay.
Okay, sir. Thank you.
Thank
okay,
you.
sir. Thank you.
Yes, this is the WhatsApp number, guys. Please note down this number. You can WhatsApp on this number. So our team will get back to you. So this is the number +91 7302411 106. ठीक है, this is the WhatsApp number. Please leave a message on this number. So we will get back to you. So whatever you have questions, you can ask one-on-one. You can talk to us.
Thank you, sir. Thank you so much. This is so knowledgeable session for nurses. Thank you so much.
Thank you, guys. Please ask some questions. Here, guy, for me, 1:30 a.m. in Australia. Might be for you, it's just in the evening.
तो सर आप सुन रहे हैं मुझे?
हाँ जी।
सर मेरा क्वेश्चन ये है, मैं पाकिस्तान से हूँ। मैं ये पूछ रही हूँ कि ये ओवरऑल जितना भी ये प्रोसेस है ऑस्ट्रेलिया जाने के लिए, जैसे है और फिर आइल्स वेटी और ये सारा कुछ जो है, तो इन कितना है टोटल ओवरऑल, जो मतलब फाइनल स्टेज तक जाने तक जो जितना ड्यूरेशन?
Pay to the government. You are not paying to us. For us, you just need to pay for this course fees only, like document verification और NCLEX का एग्जाम का fee, then English का एग्जाम का fee, visa का fees. You have to pay directly to the government, not to us. But in general, as I can say, in Indian rupees, it's going to be around 7 lakh rupees, 6 to 7 lakh, or Pakistani rupees, you can convert into that,
सर मेरा क्वेश्चन ये नहीं है, मेरा क्वेश्चन ये है कि इस पे टोटल टाइम कितना लगता है? 1 ईयर लगता है?
3 मंथ का ये एग्जाम है, और आपने एग्जाम पास कर लिया, 2 एग्जाम पास करने, तो इट इज इन योर हैंड कि एग्जाम आपको कब लिखना है, एनी टाइम यू कैन राइट, बट इन जनरल इट मे टेक अराउंड 6 मंथ टू 9 मंथ.
All the process.
Yes.
Much.
Sir,
yes, Rahman.
अगर
सर मैं ये मेरा क्वेश्चन ये है कि सर हमारा ये सेशन जो है रोजाना के हिसाब से इसी टाइम पे इसी रोजाना होगा?
नहीं, आपको क्लास दिया जाएगा. ये तो हमने एक डेमो दिखाया था, आपको ऐसा पढ़ाएंगे. वो हम लोग वीकली की जो है 5 क्लास होती है, वो आपको एक वो दिया जाएगा. टाइम फिक्स टाइम होता है वो. इन जनरल कविता, मतलब टाइम क्या रहता है क्लास का अपनी?
सर एक्चुअली इट डिपेंड्स अपॉन बैचेस ना, बच्चों की रिक्वायरमेंट के हिसाब से वी कैन एडजस्ट, बट यूजुअली इन द मॉर्निंग इट इज 11 AM to 1 PM IST.
या तो मतलब इंडिया के टाइम के अकॉर्डिंग 11 मतलब 11-12 बजे 1 बजे का.
हाँ 11 से 1 रहता है, बट अकॉर्डिंग टू बैच कितने बच्चों का है, किस कंट्री से है ना, वी कैन एडजस्ट दैट.
मतलब पाकिस्तान और इंडिया मीन द सेम टाइम अराउंड रहता है. तो जो है आप उस टाइम पे होगी आपकी. एंड
वन क्वेश्चन मोर,
अगर लाइव क्लास लेंगे प्लस रिकॉर्ड भी कर देते हैं, तो इफ यू वांट टू सी लेटर ऑन और आप हॉस्पिटल में थे, नहीं कर पाए अटेंड, देन आपको उस केस में आपको रिकॉर्डेड सेक्शन मिलेगा. कोई भी क्लास मिस नहीं होगी.
ओके बस
वो कोई भी आपसे मिस नहीं होगी एक भी क्लास. और आप फिर भी आपको कोई क्वेश्चन नहीं, आप हमारे पास में हमारा एक एप्लीकेशन है डिस्कॉर्ड पे, इज लाइक सेम लाइक व्हाट्सएप. आप वहां कभी भी क्वेश्चन कर सकते हो हमसे, तो हमारे फैकल्टी हमको कविता मैम आपको रिप्लाई करेंगे वहां पे. यस, एनी अदर क्वेश्चन? तो प्लीज व्हाट्सएप कर दें. इस नंबर भी ऑलरेडी हमने यहाँ पे हाईलाइट किया हुआ है. इस नंबर पे आप अगर व्हाट्सएप करेंगे तो हमारी टीम आपसे इमीडिएटली कॉन्टेक्ट करेगी. अदरवाइज यू आल्सो कैन लीव योर फोन नंबर इन चैट बॉक्स. यस सारा.
सर मुझे एक सवाल ये पूछना था सर, क्योंकि मैं 2-3 यहाँ के कंसल्टेंसी है जो इमिग्रेशन वगैरह का प्रोसेस करते हैं, उनसे मैं बात की थी, तो वो बता रहे कि जो भी नर्सेस अब्रॉड जाना चाह रहे हैं या फिर वहां पर माइग्रेट होना चाह रहे हैं, उनके लिए कंपलसरी है कि वो लोग क्लिनिकल साइड का एक्सपीरियंस चाहिए. पर क्योंकि मैं लेक्चरर हूँ और कॉलेज में पढ़ाती हूँ BSc नर्सेस को, स्टूडेंट्स को, तो मेरे लिए क्लिनिकल एक्सपीरियंस तो नहीं है. मेरे पास
आप भी ऐसा क्वेश्चन कर रहे हो. आप एक लेक्चरर हो, आप खुद गूगल कर लो यार. आप हमसे ही पूछे चले जा रहे हो ना. गूगल कर लीजिए, उनकी वेबसाइट पे ऐसा कहीं भी मेंशन नहीं है. इसमें एक्सपीरियंस नहीं मांगते हैं. ठीक है, आप कुछ तो देख लीजिए ना। आप तो लेक्चर, आप तो बच्चों को नंबर भी बताते हो कि भाई एविडेंस बेस्ड मेडिसिन, राइट, क्या एविडेंस है, नहीं तो आप कुछ एविडेंस देख लीजिए, इसका एविडेंस है नहीं है। इसमें एक्सपीरियंस नहीं चाहिए होता है इन जनरल, ठीक है। और नर्सिंग के यहाँ पे इतना किल्लत है, कोई जो फ्रेश बच्चा भी अगर पास कर लेता है एग्जाम, उसको जॉब यहाँ मिल जा रही है, ठीक है। हाँ, तो एक्सेस नहीं चाहिए। एक है लैब टेक्नीशियन का कोर्स, एज ए वी आर ए एडटेक कंपनी इन ऑस्ट्रेलिया, वी आर नॉट ए एजेंट, ठीक है, वी आर नॉट ए वीजा एजेंट। हमारा जॉब है कि आपको राइट गाइडेंस देना। मतलब पिछले 6 साल से मेरे यूट्यूब चैनल में आपको गाइड करता था, वहाँ बता दे बच्चों के लिए। तो ओनली लैब टेक्नीशियन रिक्वायर्ड होता है 2 ईयर का वर्क एक्सपीरियंस, तभी वो लोग अप्लाई कर पाते हैं। बाकी नर्सिंग प्रोफेशनल, फार्मेसी प्रोफेशनल या मेडिकल डॉक्टर या डेंटिस्ट, इनके लिए वर्क एक्सपीरियंस नहीं चाहिए फॉर ऑस्ट्रेलिया।
जी, थैंक यू सर।
जो लैब टेक्नीशियन
सर
अगर कोई यहाँ पे हो, उसको 2 साल का एक्सपीरियंस होना मैंडेटरी है। यस, नेक्स्ट प्लीज।
सर यहाँ पे जो डेटा फ्लो वगैरह करवाते हैं पाकिस्तान में, वहाँ से भी डेटा फ्लो कर सकते हैं हम?
डेटा फ्लो मैंने वही बताया, डेटा फ्लो का मतलब होता है डॉक्यूमेंट वेरिफिकेशन, तो वो हम
डॉक्यूमेंट वेरिफिकेशन सर।
वो हम करवाएंगे आपको ऑस्ट्रेलिया में। तो उसके बगैर तो आप एग्जाम में नहीं बैठ सकते ना, पहले तो आपको
नहीं,
डॉक्यूमेंट।
अगर
हाँ, वो आपको हम
डॉक्यूमेंट
करके
वेरिफिकेशन,
होंगे, वो पाकिस्तान से ही होंगे। आपको जैसे अपनी स्कैन कॉपी देनी होगी हमारे लिए।
अच्छा सर, नहीं यहाँ पे मुख्तलिफ अगर वो है कंसल्टेंसी वगैरह, वो करवा के कि मैं डॉक्यूमेंटेशन वेरिफिकेशन में करवाऊंगा, फिर इसके बाद मैं।
ऐसा ऑस्ट्रेलिया के लिए ऐसा कुछ नहीं होता है, ये सब करवाते, वो करवाते हैं गल्फ कंट्री के लिए, कि सऊदी या
अच्छा
दुबई, दुबई ये सब कंट्री के लिए। ऑस्ट्रेलिया, यूएस, कनाडा, ये हाई इनकम कंट्री है ना, तो यहाँ ये सब चीजें नहीं होती हैं, है ना।
जी जी
वो
सर।
वो खुद चेक कर लेते हैं वेरिफिकेशन। ये डेटा फ्लो होता है बेसिकली दुबई के लिए, जो आप पूछ रहे हो। मगर मैंने
अच्छा,
आपको बताया यहाँ ऑस्ट्रेलिया में उसको बोलते हैं स्किल असेसमेंट, या उसको बोलो,
ओके
ये
सर।
सिंपल सिंपल वर्ड में बोलो डॉक्यूमेंट वेरिफिकेशन। दे वांट टू चेक योर डिग्री और योर कहाँ से आपका रजिस्ट्रेशन किया है, अपने आप रजिस्टर्ड नर्स हो या नहीं हो, वो सब चेक करते हैं।
सर डॉक्यूमेंट वेरिफिकेशन में डिग्री और एक्सपीरियंस मैंने तो जो जगह से, क्योंकि मैंने एक वर्डप्रेस से किया और दूसरा जो है एक मैं शेख ज़ौदा हॉस्पिटल में काम कर रहा हूँ,
हाँ, तो अगर वर्क
कोयटा
एक्सपीरियंस तो आप दिखा सकते हो। बेसिकली आपको डिग्री चाहिए होगी, आपको ट्रांसक्रिप्ट, ट्रांसक्रिप्ट जो होती है, जो सारे ईयर की जो मार्कशीट होती है, वो चाहिए होगी। और आपका जितना वर्क एक्सपीरियंस है वो आप दिखा सकते हो। और आपका रजिस्ट्रेशन मैंडेटरी है, आप यू मस्ट बी रजिस्टर्ड नर्स इन योर स्टेट नर्सिंग काउंसिल।
पीएनसी पाकिस्तान नर्सिंग काउंसिल से।
यस, यस, बस उतने डॉक्यूमेंट चाहिए। वो पासपोर्ट वगैरह चाहिए और नेशनल आईडी चाहिए, वो सब नॉर्मल डॉक्यूमेंट चाहिए होंगे आपके।
सर इनको आप हमें बता सकते हैं अभी, या बाद में हम पूछ लेंगे ये अरिंदम सर से?
हाँ, रिदम सर, सब्जेक्ट टीम
डॉक-
को वन ऑन वन बताएगी वीडियो पे, बात करके सारी सारी चीजें। आप अभी भी पूछ सकते हो, कोई क्वेश्चन है तो बाकी वो टीम आपको वन ऑन वन बताएगी।
जी सर, बस यही भी डॉक्यूमेंट वेरिफिकेशन के मैंने पूछना था, उसके चार्जेस कितने आएंगे, और चार्जेस के बारे में मैंने पूछना था सर।
अच्छा, अच्छा, तो वो अभी अरिंदम की टीम बता देगी। बट इन जनरल गवर्नमेंट की फीस अरिंदम कितनी है इसकी, एनक्लेस की?
सर $640
640। नेहा इज हियर। सो आप अपना वो छोड़ दीजिए, आप इस नंबर पर, तो हमारी टीम आपसे कॉन्टेक्ट करेगी वन ऑन वन बेसिकली। तो वो आपको हर एक
श्योर सर, मैंने।
बताएंगे कि डॉक्यूमेंट वेरिफिकेशन में कितना चाहिए आपको, एग्जाम में कितना चाहिए, और इंग्लिश में कितना चाहिए, फीस कितनी चाहिए, वो सारा बताएंगे आपको स्टेप बाय स्टेप।
ठीक है सर, बस हमारे यहाँ पे तो वैसे कोई भी है नहीं बलूचिस्तान में सर, आपने कहा कि हम बलूचिस्तान में आए हुए हैं सर, आप आए हैं
बलूचिस्तान
बलूचिस्तान?
हम नहीं आए हुए हैं। आपका जो यूनिवर्सिटी
अच्छा।
बलूचिस्तान है ना, तो वहाँ का जो
जी जी।
डिपार्टमेंट ऑफ फार्मेसी प्रैक्टिस जो है, फहाद सलीम वहाँ पर है, वो मेरा दोस्त है, नहीं, वो मेरे साथ में पीएचडी किए थे मलेशिया में, है ना। तो ही इज नॉन टू मी।
ओके सर।
और आपके वैसे बहुत सारे बच्चों
अच्छा
के मेरे पास थीसिस आती है चेक करने को, पीएचडी वाले बच्चों की। तो मैं तो इसलिए मुझे बहुत सारे बच्चे वहाँ पे जानते हैं बेसिकली, आपके पाकिस्तान में।
अच्छा अच्छा सर सर
और
सर,
आप
बस मुझे ऑस्ट्रेलिया के जाने के लिए वो आपने की सपोर्ट चाहिए सर, आपके
बिल्कुल बिल्कुल,
बैकअप
हम तो यहाँ
आपकी।
पर हैं, हम तो बेसिकली बहुत सारे बच्चे पाकिस्तान के हमारे पास में आ चुके हैं ऑलरेडी। यहाँ पर
ओके।
एक हमारा लड़का था अभी, अहमद करके, वो आपके यहाँ का था, इस्लामाबाद का। वो अभी
जी सर।
ऑस्ट्रेलिया में आ गया है, उसका हमने इंटरव्यू डाला हुआ है हमारे यूट्यूब चैनल पे। आप लोग यूट्यूब चैनल पे जाके देख सकते हो, हम बहुत सारी इंटरव्यूज करते रहते हैं जो कैंडिडेट्स जो होते हैं, और वीडियोस वगैरह।
जी सर, ठीक है सर, थैंक यू सो मच सर।
कल सुबह को हमारी टीम आपसे कॉन्टेक्ट करेगी, ठीक है।
ओके सर। सर एक्चुअली मैं हॉस्पिटल में सिग्नल काम का नहीं करता, मुझे अगर व्हाट्सएप पे मुझे एक
हाँ,
मैसेज और दें तो
वो आपको व्हाट्सएप करेंगे पहले।
सर आपके यूट्यूब चैनल का नाम बताइएगा मुझे जरा।
सर लिंक काइंडली अगर यूट्यूब वाले चैनल वो बता दें।
कैन यू प्लीज शेयर आवर यूट्यूब चैनल का लिंक दिखा दो।
Sure, doing it.
काइंडली सर टेक्स्ट ऑन।
हाँ, व्हाट्सएप पे ही सबको टेक्स्ट जाएगा बेसिकली। इन जनरल ईमेल भी जाएगी आपको, व्हाट्सएप पे टेक्स्ट भी आएगी।
जी सर।
जिस
सर
नंबर
यहाँ
पे
पे अगर
उस नंबर पे ना सर
चैट में भी इस तरह ही अगर हम लिंक अगर शेयर हो जाए तो वो काफी बेहतर होगा।
बिल्कुल।
थैंक यू सर, थैंक यू।
Sir, hello, can I have one question more? One question.
Yes, please.
Okay, how we can get the lecture?
You are asking that this lecture?
सर वो थी वो दफा सर अल्लाह चाहता चले सर मुझे गाल न बुधो प्लीज।
These are the basically channel for nursing professional. Last one, and this is my personal channel, so you can find a lot of stories. We always guide the students migrate off here.
अच्छा
Yes, professional subscribe कर लो, बहुत सारी यहाँ पर information मिल जाएगी. And yes, फिर हम तो tomorrow will have team you.
ठीक है बस कर रहे मत होने का।
ठीक है, अभी दोस्तों यहाँ पर 1:30 बज चुका है और मेरे को नींद आ रही है। ठीक है, अभी ये फिर
सर तव्हां सुम्ही पियो सुकून सां सुम्ही पियो सर, कोई मसले जी ॻाल्हि ही न सर।
ओके, थैंक यू सो मच। ठीक है एकदम।
अल्लाह हाफिज़ सर, अल्लाह हाफिज़। बोलो मत में
Thank you. Good night.
थैंक यू सर।
Bye.
गुड नाइट।
अरिंदम सर,
थैंक यू मैडम।
Thank you. I'll once again share my screen. Just note down the phone number. You can drop us a WhatsApp for further information. This is the number. Just take it. Let's take a note of it.
ओके सर।
ओके सर, अल्लाह हाफिज़, अल्लाह हाफिज़।
Okay. Thank you.